Well, thank you so much. I was looking forward to this gathering. The first time when I was approached about participating in this panel, I was at the University of Texas at Arlington, and I was transitioning to University of Louisiana Lafayette. And I have now 4 months in this job, doing lots of things that are somehow related to what I did in the past, but because of the project on COVID-19, the focus of my presentation is going to continue to be on the work that was funded through the CDC with the University of Texas at Arlington. So I will describe, and for some reason I cannot advance my slides.
Try the right arrow. I had a problem with the down arrow before.
Hold on one second. I think I got it. Okay. Can you see?
Yes, great.
Okay, wonderful, wonderful. So the title of the grant that we received through the CDC and mainly through the Tarrant County Public Health Department, where Arlington, University of Texas at Arlington was located, was National Initiative to Address COVID-19 Health Disparities Among Populations at High Risk and underserved, including racial and ethnic minority population and rural communities. So the entire Department of Public Health in Tarrant County received $16 million. And they were really good connecting all community partners to be part of this big initiative. So the intended outcome of this funding was really to reduce COVID-19 related health disparities, and there were multiple public health departments across the country that received funding. Texas was able, Tarrant County in particular, was able to have a very compelling story because we had Hispanic population now is majority minority in North Texas. And we could see that there was reluctance in accepting vaccines, or there were some stigma and lots of misinformation. So part of our focus was really looking at minorities, but with a focus on the Hispanic population in North Texas. So what we wanted to accomplish through this grant was to improve and increase testing and contact tracing at that time. So this funding was for a period of 3 years among the populations at high risk, those underserved, and with a focus also on the rural communities. And let's face it, Texas has lots of rural communities, especially North Texas. The goal at the national level was, and in particular here, Texas, was to improve state, local, and U.S. territorial and freely associated state health department capacity and provide more services in order to be able to control infection among populations at high risk. So part of the approach that we used in Tarrant County was to focus on 3 areas. So it's like a stool with 3 legs. We want to reduce disparities related to COVID-19, but how do we do that? So it was clear from the beginning that we had to have a very strong communication messaging initiative across the North Texas, all be consistent messages that are being disseminated across different groups. We also needed to involve community in the process. So, community health workers, public library, faith-based organization, grassroots, etc. And then also we needed to focus on countering the misinformation that was going through different areas that would play a role in the marketing, in promoting the vaccine and all the initiatives that the public health department was trying to promote. The second leg of the stool was partnership was going to be extremely important. So train with and include more partners to do the contract tracing, include transportation so people can go to different pharmacies, for example, where the vaccine was going to be distributed, have mobile units in place in the areas where there were no pharmacies that were delivering the vaccine. Make sure that everybody has access to distribution of the vaccine. And of course, other barriers such as PPE, limited paid leave, and etc. And last but not least was to focus on reducing the cultural barriers. So make sure that we use the trusted resources connections for vaccine sites, address the language and cultural barriers that existed. So I mentioned we are heavily in the Hispanic population, and we wanted to make sure that COVID-19 is not being translated as the gripa, which means influenza, in fact, in Spanish. So we noticed there were lots of announcements at the airport, for example, where the translation for get tested for COVID-19 were translated get tested for gripa. And in the Hispanic population, gripa is not COVID-19. Gripa was really influenza, gripa. So that was something that we wanted to address, so people do not think that this is just a gripa, an influenza. It's something much more complicated. Build and improve the relationships with the communities, especially those underserved, and of course, involve the community in the entire process from the beginning until the end. So as a PI for the UTA site, I wanted from the beginning, and again, I'm a health informatician, moved into public health informatics during the pandemic. At that time, I was still in Indiana, moving into a new role at the University of Texas at Arlington, and I started tracking the number of COVID cases, first in Indiana, and then I said, wait a minute, I am starting a new job. So I started my job in Texas March 1st of 2020. March 13 was the pandemic, when the pandemic was declared. And I couldn't move to Texas until August. So I did all this work first, tracking and making sure that I understand the community where I'm going to move. And then I realized this is much bigger than just me as an individual tracking cases, but it's actually something that I think that we can help with data, analyzing the data, identifying the high-risk neighborhoods, and all of these aspects. So I wanted from the beginning, as a co-founding co-director of a center focused on health informatics, to establish the center as a good partner for the university, but also be part of the solution by collaborating with community partners to prepare and monitor cases COVID-19 in Tarrant County. And lots of this work was done for free at the beginning, just because we care about the community. And then, of course, by connecting with Tarrant County Public Health, I got the opportunity to also receive funding. So from the beginning, the way that we approached this as a university, my entire team was, we wanted to build trust in our citizens to accept the COVID-19 vaccine when that would be available. At that time, it wasn't, we were just talking about it. We participated in contact tracing and other things, but we knew when the vaccine is going to be available, we wanted to make sure everybody has access. Then we wanted to provide to the Tarrant County communities in high-risk neighborhoods information that is culturally sensitive related to the vaccine and COVID-19 health in general. We wanted to also be able to support the equitable distribution in high-risk neighborhoods. And we wanted to be able to continue to monitor the impacts of the pandemic, because at that time we were thinking it was going to be just a few months or maybe 1 year, but we all know that it took longer than that. And that's why it was very important to monitor, continue to monitor the impacts of the pandemic, vaccination, emerging variants, and even now long COVID. People are still working in this to see the impacts on general health. So I'm going to describe a little bit on how we supported equitable COVID-19 vaccine distribution in high-risk neighborhoods and how we used the data and health informatics and public health informatics to address these needs to support public health department in Tarrant County. So what we thought about was people, they need to see it on a map to have a better visual instead of just graphs and data and correlations and coefficients. In public health, as you probably know, it is much easier when they look at pinpoint, okay, the zip code level, the census tract level, where is this located? So for us, the focus was from the beginning to do a data-driven health intelligence approach in preparing for vaccine distribution and monitoring of the pandemic. So what you see in this map is Tarrant County, where we are able to identify high-risk neighborhoods at the census tract level. So what you see darker red are those high-risk neighborhoods. We also we have a paper that I'm citing here that describes the entire approach. But by doing this, what we were able to show Tarrant County Public Health Department was where you are going to distribute the vaccine, where you see the pharmacies with the white cross, you see the high-risk neighborhoods that are showed in red here. They don't have a pharmacy. They didn't have a pharmacy in those areas. So we were able to help deploy the vaccination, the mobile units that will go into those neighborhoods to really provide information. The vaccine is available, but also do the vaccination. So that was extremely important because what we did is not just adding a social vulnerability index. We also added all the SDOH data, including health literacy, and of course the demographics. But the health literacy played an important role here, even though the data was from 2017. We use that as an indicator. Where do we need to go and discuss more or provide more information in any type of form? It can be focus groups where we did surveys on paper. We did sessions with church leader, faith-based organizations, with the public libraries, just to be able to provide the information that was needed in a very sensitive, culturally sensitive manner. So how then, for the next step, how did we monitor for the impacts of the pandemic and the vaccination rate? So that was a second part of the study that we did. And we kind of focused our research on two hypotheses. We all love social media, right? So we also know that when the vaccine became available, everybody was super excited and everybody wanted to get the vaccine, even though it was age categories. So first we vaccinate the elderly and those who are more vulnerable. Then it was the teachers. I'm not talking about, of course, the healthcare workers who are frontline and they received the vaccine first. But lots of people wanted to get a vaccine even if it wasn't the time. And there were huge lines, I remember, in auditoriums, in stadiums across North Texas. And then all of a sudden, people started talking about, you shouldn't get the vaccine, you shouldn't do that. So what we did, we wanted to use social media to be able to analyze the sentiments that can influence vaccination rate. Is there any correlation? And then what other factors contribute to vaccine hesitancy? So all of this was done, of course, in combination with interviews and focus groups in the community. But my group focused mainly on analyzing social media activity. We did that. First, we started with Twitter, now X, analyzing the data, and we realized that the Hispanic population was not using Twitter. They were using Facebook. And because of that, we said we have to study in both English and Spanish. So we developed, we use natural language processing, machine learning, AI, everything that was at our disposal to really be able to identify what sentiments are being shown by the population in both languages related to the vaccine. What is it that they worry about and they talk about? So then when we work together with our community partners in the public health department, then we can have the messaging done in such a way to address those concerns, instead of just saying, hey, you should take the vaccine because the government wants you to take it. So then we also look at the health literacy and social vulnerability index, and we realize that the vaccination rate is highly influenced also by the level of health literacy and, of course, the SVI index. So the conclusion of this study, and I listed here 2 of our publications, we added a few more after that on other topics. One is abortion, for example, and we know Texas was the first one for the pushing for the abortion law. So we wanted to also look at stance towards abortion. But social media is really a powerful way of really understanding how people feel about certain things. And instead of just saying that you shouldn't listen or go on social media to get information, we should all be very active. And instead of going into a bystander mode, and we have a paper on that too, when there is very toxic information being put on social media, those of us who know the truth and the science behind decide to remove ourselves from that situation instead of going on social media and providing the correct information. So all of these studies were correlated very closely with what we are seeing in the community through the interviews, through the focus groups. And it would, by education, we are able to, of course, increase vaccination rate in areas where it was much lower before. So we receive the data from Public Health Department on vaccination every month. And we are now in the process of publishing the study that correlates all of the social media sentiments with the vaccination rate, real vaccination rate from the Public Health Department. So the third piece of our study was also how can we help build trust and provide that cultural sensitive information that's so needed? And it was needed during the pandemic, and it's still needed now in many different aspects. So part of, even though it was not funded by the CDC, this was a different study that we wanted to include the high school students as our champions for providing the correct information to their families, with a focus again on the Hispanic population. And why? Because in Texas, you can become a certified community health worker at age 16. And we realized that some of these community health workers, certified community health workers, were in high schools. We identify high schools in the predominantly Latino neighborhoods where vaccination rate was very low. And we realized that if we are using these CHWs in high schools to train them on how to talk about COVID-19 vaccine, they will go home to their families. And we know the Hispanic families, they live in multi-generational households, meaning that whatever information comes from school needs to go to the parents and grandparents. They will discuss it and they will approve it or disapprove it. So if we have the right training of our CHWs in high school, they can go in those communities and really talk about the correct information that needs to be provided regarding COVID-19. Because of this project, so we developed a training for CHW in high schools in those areas of high risk. And we received because of the project, we received the inaugural Racial Justice and Equity Award by the Coalition of Urban Serving Institutions in 2021. And I am extremely proud of being able to get to that level. It really put on the map the efforts that UTA, University of Texas at Arlington, was doing in the community, knowing that UTA was and it is a Hispanic serving institution. So that was amazing for all of us. We are very proud. And we organized the first symposium on racial justice and equity at our university the following year because of this award. So that was great visibility. So there are way too many people that I should acknowledge here and thank. So what I thought was to really put in this diagram all the individuals, all the community partners that contributed to this entire effort. Of course, the University of Texas at Arlington, I worked with the libraries, we work with public health, with TESOL as well, all partnering schools, and of course the La Alianza in the DFW area with the community health workers as well, and Health Literacy Texas. So we all together, we are able to achieve much more than working in isolation. We are able to inform about COVID-19 and the vaccines. We are able to address the community concerns that existed. And I think we are able to really combat misinformation by having targeted messaging that was provided as a result of the social media analysis and the interviews we did in the community. So I wanted to end with this beautiful mural that was painted by UTA students during the lockdown, where nobody was able to go on campus. They will go one at a time, art students, and they would start building this beautiful mural that now reminds us. I hope to be able to go back there to revisit this, but really is a reminder of those times when we all came together and we wanted to solve a big problem that hopefully we are not going to experience again. So here are my references in case anybody is interested. Thank you so much, Florence. The two of us connected at the HIMSS conference of, I don't even know, last year. It feels like it's more than 1 year, but through this connection we made, I am so grateful and really proud that you included me in this beautiful panel. Thank you so much. I appreciate it.